Hello, this is Jara, and I'm from Centris Nation. Today we have with us Dr. Tasnim Jara. Hello, Apu. How are you doing?
I'm doing great. Thank you for having me here.
You're most welcome. So, I would like to know, how can investment in public health infrastructure can drive the sustainable economic growth in Bangladesh?
Let's think of it this way. A healthy population isn't just a moral imperative, it is an economic engine. Every taka we invest in public health pays dividends in productivity, resilience, reduced poverty. And we are talking about clean hospitals, accessible emergency care services, trained personnel. We are talking about digital health records, the basics. And more importantly, we need to shift our model of care from sick care to preventative care. So more focus on community clinics, on digital health prevention tools, on telemedicine access, on real-time disease surveillance. And to be honest, $1 trillion economy cannot be supported by weak hospitals and overworked doctors. So investment in public health is paramount to driving sustainable economic growth in Bangladesh.
Thank you. How do you think the private sector investment could improve healthcare accessibility in Bangladesh?
So I think the private sector can be a game changer if guided smartly. From diagnostics to last mile logistics, private health tech startups, private companies can plug the gaps where the public sector falls short. So we need to de-risk investment in rural health. We need to incentivize affordable diagnostics. We need to embrace public-private partnership models that put people before profit. And honestly, let's make private capital a partner for public good. When business meets compassion, innovation becomes accessible, right?
Absolutely. So I wanted to ask something that I'm really curious about. How do you see the healthcare reform happening? Like, what's the vision? How do you see it happening within the next couple of years?
Right. So I think fundamentally, we need to move away from a crisis response system that is the current state of our healthcare to a resilience building one. And from National Citizen Party, we are talking about a few key reforms. So firstly, we need to strengthen our primary care. So clinics before hospitals. We need to develop an emergency care framework. So according to WHO, more than half of the deaths in low and middle income countries could be addressed by effective emergency care. So we need to have accessible, effective emergency care framework. We need digital health adoption for our records, for reports to promote preventive healthcare. We need affordable innovation, low-cost devices. We need a national biobank. You've been in China, you know about the China Kadoorie Biobank. We need a biobank to advance research and to power precision medicine. We need decentralization of governance. We cannot just wait on Dhaka. And last but not the least, we need workforce expansion. We need more trained doctors, we need more trained nurses, midwives, paramedics, community health workers. And the existing healthcare workforce, the doctors, nurses, paramedics, the allied healthcare professionals, they also need adequate compensation. They need clear career progression pathways. They need safeguards against workplace violence. Again, basics, but we are struggling to provide those. So we need really an overhaul of the existing workforce strategy. We need to modernize them. And like I said before, so we need to strengthen our primary care. We need to develop emergency care. We need digital health adoption. We need to decentralize our governance. We really need to advance research. We need to foster innovation. And let's just stop patching the system. We really need to redesign it for dignity, for efficiency, and for our next generation.
You've been in NHS previously. So doctors in Bangladesh are always overworked. So how do you think we could make a change to give them a better work-life experience? Because you've already spoken about the compensation. So what do you think could be done to give them a better mental health stability with their work and their lifestyle?
So I think doctors being overworked is a symptom of the whole infrastructure that we have in healthcare, where it's not really serving the patients, it's not really serving the doctors, or the healthcare professionals. So we really need an overhaul of the entire system. And of course, our healthcare personnel do need adequate compensation. They need clear career progression pathways, and we need workplace safety as well. So again, basics, but we're struggling to maintain them. So I think we need a big overhaul of the whole infrastructure with public investment, with private investment, and really a reimagining of the system to serve all the stakeholders better.
Do you think during this healthcare summit, we will be having prospective investors who would be willing to invest in research or treatment breakthroughs or transplant technology and anything that is related to reform the healthcare in a different way so that we wouldn't have to go to a different place for treatment? Our citizens of Bangladesh can take all the premium treatments in our own country.
Well, I would hope so. I mean, as we've heard over and over again, it's Bangladesh does need the services that you talked about, and there's a lot of appetite from the people as well. There is real need, and I mean, I meet these young innovators and they speak about ideas. Some of them sound crazy, but those would be so good if you could implement them. So I think for to have those innovations, to have those investments, we need that infrastructure. We need dedicated health incubators, health innovation incubators. We need dedicated grants. We need fast-tracked regulatory clearance for pilot projects. We need youth voices in our policy reform forums, in our health policy forums. And honestly, I don't think that the next revolution in Bangladeshi healthcare will come from boardrooms. It's likely to come from bold 25-year-olds with purpose, with Wi-Fi access, and maybe some of the people we've met here today are gonna bring those reforms. And also, more importantly, we need to focus on education. So our medical curriculum, our nursing curriculum, the health curriculum of allied health professionals, we need education on entrepreneurship, on digital tools there, so that we get more entrepreneurs, more innovators from our existing pool as well.
In the United States, there are often medical summits which are hosted where different students of different backgrounds come over to get a better prospect of the medical world. It's a vast world. It's not just limited to a doctor. It's a huge sector. So do you think there would be any possibility, would you want to see Bangladesh 2.0 host such summits to promote the education and the quality of healthcare? Because the newer generation is the future of Bangladesh 2.0.
Absolutely. I mean, we've had summits and conferences throughout the past few years, but of course now we are reimagining our healthcare. We want the healthcare to work for the people, who work in the healthcare sector. So as we are reimagining it, I would hope there would be many national and international partners coming together in summits, conferences, meetings, and many other settings, hopefully. And I hope to see a lot of energy in reforming our healthcare sector so that it works for Bangladesh.
So to conclude it, do you have any message for the healthcare community of Bangladesh?
Well, I'm really energized by the innovations and the creativity that we are seeing in our healthcare community, and I really hope we can work together and make sure that healthcare is accessible and affordable for the people of Bangladesh.
Thank you so much for joining us today.